activated compounds linked to an oral solution containing 1.25 mg triprolidine hydrochloride, 30 mg pseudoephedrine hydrochloride and 10 mg codeine phosphate in each 5 ml of pink, fruit-flavored liquid. Also contains sodium benzoate. Uses. This combination product is used to treat symptoms caused by the common cold, flu, allergies, hay fever, or other breathing illnesses, e.g., sinusitis, bronchitis. Decongestants help relieve stuffy nose symptoms. This product also contains an opioid cough suppressant antitussive that affects a certain part of the brain, reducing the urge to cough. Antihistamines relieve watery eyes, itchy eyes, nose, throat, runny nose, and sneezing. Opioid cough suppressants should not be used in children younger than 18 years. Children are at higher risk for serious, even fatal side effects, especially breathing problems. Talk with the doctor about the risks and benefits of this medication. Cough and cold products do not cure colds. Cough due to a common cold often does not need to be treated with medicine. Ask your doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or saline nose drops spray. Side effects: drowsiness, dizziness, headache, blurred vision, upset stomach, nausea, constipation, or dry mouth, nose, throat may occur. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. To relieve dry mouth, suck on sugarless, hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. This medication can dry up and thicken mucus in your lungs, making it more difficult to breathe and clear your lungs. To help prevent this effect, drink plenty of fluids unless otherwise directed by your doctor. If your doctor has directed you to use this medication, remember that he or she has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Tell your doctor right away if you have any serious side effects, including interrupted breathing during sleep, sleep apnea, mental mood changes, e.g., hallucinations, ringing in the ears, shaking, tremors, trouble urinating, weakness, easy bruising, bleeding, fast, slow, irregular heartbeat. Get medical help right away if you have any very serious side effects, including seizure. This product may cause serious mental mood changes and very serious, rarely fatal, breathing problems. This product may contain codeine or dihydrocodeine. Codeine and dihydrocodeine are changed into strong opioid drugs, morphine or dihydromorphine, in your body. In some people this happens faster and more completely than usual, which increases the risk of very serious side effects. Get medical help right away if you notice any of the following: slow, shallow breathing, severe drowsiness, difficulty waking up, confusion. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching, swelling, especially of the face, tongue, throat, severe dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. Precautions: before taking this product, tell your doctor or pharmacist if you are allergic to it, or if you have any other allergies. This product may contain inactive ingredients, which can cause allergic reactions or other problems. Talk to your pharmacist for more details. Before using this medication, tell your doctor or pharmacist your medical history, especially of abdominal problems, e.g., chronic constipation, ileus, gallbladder disease, pancreatitis, adrenal gland problem, e.g., Addison's disease, certain brain disorders, e.g., head injury, tumor, increased intracranial pressure, breathing problems, e.g., asthma, emphysema, sleep apnea, diabetes, a certain eye problem, glaucoma, heart problems, high blood pressure, kidney problems, liver disease, mental mood problems, e.g., depression, psychosis, seizures, stomach intestinal problems, e.g., ulcers, blockage, thyroid problems, e.g., hyperthyroidism, hypothyroidism, urination problems, e.g., trouble urinating due to enlarged prostate, urinary retention, personal or family history of a substance use disorder such as overuse of or addiction to drugs, alcohol, obesity. This drug may make you dizzy or drowsy or blur your vision. Alcohol or marijuana, cannabis, can make you more dizzy or drowsy. Do not drive, use machinery, or do anything that needs alertness or clear vision until you can do it safely. Avoid alcoholic beverages. Talk to your doctor if you are using marijuana, cannabis. To minimize dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. This medicine may contain aspartame. If you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame or phenylalanine, consult your doctor or pharmacist regarding the safe use of this medicine. This medication may contain sugar and/or alcohol. Caution is advised if you have diabetes, alcohol dependence, or liver disease. Ask your doctor or pharmacist about the safe use of this product. Older adults may be more sensitive to the side effects of this drug, especially confusion, dizziness, drowsiness, slow shallow breathing, fast heartbeat, constipation, and trouble urinating. Confusion, dizziness, and drowsiness can increase the risk of falling. Tell your doctor if you are pregnant or think you may be pregnant. During pregnancy, this product is not recommended. It may harm an unborn baby. Talk to your doctor about the risks and benefits of this medication. See also warning section. This product may pass into breast milk and may have undesirable effects on a nursing infant, such as unusual sleepiness, difficulty feeding, trouble breathing, or unusual limpness. Breastfeeding while using this product is not recommended. Consult your doctor before breastfeeding. ActiFed compounds linked this presentation. An oral solution containing 1.25 mg triprolidine hydrochloride, 30 mg pseudoephedrine hydrochloride, and 10 mg codeine phosphate in each 5 ml of pink, fruit-flavored liquid. Also contains sodium benzoate. Indications. ActiFed compounds linked this is indicated for the symptomatic relief of upper respiratory tract disorders which are benefited by a combination of nasal decongestant, a histamine H1 receptor antagonist, and an antitussive. Dosage and administration. Dosage for adults including elderly, over 18 years only. 10 ml syrup 3 times daily. Do not exceed the stated dose or frequency of dosing. The elderly. Although there have been no specific studies of ActiFed compounds linked in this group of patients, it may be anticipated that the elderly may be more susceptible to adverse effects. Therefore, reduced dosage and careful monitoring is advised, particularly in cases where there is impairment of renal, hepatic, or mental status. Contraindications. ActiFed compounds linked is contraindicated in patients under the age of 18 years. ActiFed compounds linked is contraindicated in individuals who have previously exhibited intolerance to it or to any of its constituents. ActiFed compounds linked is contraindicated in patients with severe hypertension or severe coronary artery disease. ActiFed compounds linked is contraindicated in patients who are taking or have taken monoamine oxidase inhibitors within the preceding 2 weeks. The concomitant use of pseudoephedrine in this type of product could occasionally cause a rise in blood pressure. Severe reactions have occurred with codeine and monoamine oxidase inhibitors. They are generally immediate and may result in hypotension, shock and coma, or conversely hypertension and excitement. The antibacterial agent, furazolidone, is known to cause a dose-related inhibition of monoamine oxidase. Although there are no reports of hypertensive crises caused by the concurrent administration of ActiFed compounds linked and furazolidone, they should not be taken together. ActiFed compounds linked is contraindicated in patients with pheochromocytoma. ActiFed compounds linked should not be administered to patients where cough is associated with asthma or where cough is accompanied by excessive bronchial secretions. Codeine, in common with other centrally acting antitussive agents, should not be given to patients in or at risk of developing respiratory failure. ActiFed compounds linked should not be administered to patients with severe hepatic impairment as it may precipitate hepatic encephalopathy. ActiFed compounds linked should be avoided in patients with moderate to severe renal impairment, glomerular filtration rate less than 20 ml min. Actifed compound Linctus is contraindicated in patients with head injury or raised intracranial pressure since further depression of respiration will increase cerebral edema. Actifed compound Linctus is contraindicated in all but the mildest forms of ulcerative colitis since in common with other narcotic analgesics it may precipitate toxic dilatation or spasm of the colon. Actifed compound Linctus is contraindicated for post-operative management in children younger than 18 years of age following tonsillectomy and/or adenoidectomy. Actifed compound Linctus should be avoided in adolescents 12 to 18 years of age who have other risk factors that may increase their sensitivity to the respiratory depressant effects of codeine. Risk factors include conditions associated with hypoventilation, such as post-operative status, obstructive sleep apnea, obesity, severe pulmonary disease, neuromuscular disease, and concomitant use of other medications that cause respiratory depression. Actifed compound Linctus should not be used in people of any age who are known to be sick 2D6 ultra-rapid metabolizers, because of the potential for serious adverse reactions, including excess sedation, respiratory depression, and death in a breastfed infant. Breastfeeding is not recommended during treatment with codeine. Precautions and warnings: actifed compound Linctus may cause drowsiness and impair performance in tests of auditory vigilance. Patients should not drive or operate machinery until they have determined their own response. Although there are no objective data, users of actifed compound Linctus should avoid the concomitant use of alcohol or other centrally acting sedatives. See drug interactions. Although pseudoephedrine has virtually no pressor effects in normotensive patients, actifed compound Linctus should be used with caution in patients taking antihypertensive agents, tricyclic antidepressants or other sympathomimetic agents such as decongestants, appetite suppressants, and amphetamine-like psychostimulants. The effects of a single dose of actifed compound Linctus on the blood pressure of these patients should be observed before recommending repeated or unsupervised treatment. Actifed compound Linctus should be used with caution in patients with hypertension, heart disease, diabetes, hyperthyroidism, elevated intraocular pressure, prostatic enlargement and urethral structure. Codeine or other narcotics may obscure signs on which to judge the diagnosis or clinical course of patients with acute abdominal conditions. There have been no specific studies of actifed compound Linctus in patients with hepatic and renal dysfunction. Where not contraindicated, actifed compound Linctus should be given at less than the usual recommended dose and the patient's response used as a guide to further dosage requirement. Mutagenicity and carcinogenicity: there is insufficient information available to determine whether triprolidine, pseudoephedrine and codeine have mutagenic or carcinogenic potential. Teratogenicity: in rats and rabbits, systemic administration of triprolidine up to 75 times the human dosage did not produce teratogenic effects. Systemic administration of pseudoephedrine, up to 50 times the human dosage in rats and up to 35 times the human dosage in rabbits, did not produce teratogenic effects. There is insufficient information available to determine whether codeine has teratogenic potential. Fertility: no studies have been conducted in animals to determine whether actifed compound Linctus has potential to impair fertility. There is no information on the effect of actifed compound Linctus on human fertility, pregnancy and lactation. Although pseudoephedrine, triprolidine and codeine have been in widespread use for many years without apparent ill consequence, there are no specific data on their use during pregnancy. Caution should therefore be exercised by balancing the potential benefit of treatment to the mother against any possible hazards to the developing fetus. Pseudoephedrine, triprolidine and codeine are excreted in breast milk in small amounts, but the significance of their effects on breastfed infants is not known. It has been estimated that 0.5 to 0.7% of a single dose of pseudoephedrine ingested by a mother will be excreted in the breast milk over 24 hours. Actifed compound Linctus should not be given to women during the last trimester of pregnancy since codeine may cause withdrawal symptoms in the neonate. Administration of opioids during labor may produce gastric stasis and increase the risk of vomiting and aspiration pneumonia in the mother. In nursing mothers, who are ultra-rapid metabolizers of codeine, higher than expected serum and breast milk morphine levels can occur. Morphine toxicity in babies can cause excessive somnolence, hypotonia and difficulty breastfeeding or breathing. In severe cases, respiratory depression and death can occur. The lowest effective dose should be used for the shortest possible time. Nursing mothers should be informed about carefully monitoring the infant during treatment for any sign and symptoms of morphine toxicity such as increased drowsiness or sedation, difficulty breastfeeding, breathing difficulties, and decreased tone, and seeking immediate medical care if such symptoms or signs are noticed. Codeine-containing products must not be used while breastfeeding. Potential for abuse. Prolonged use of high doses of codeine can produce drug dependence of the morphine type. However, this is unlikely to occur with short-term use at the recommended dosages. Drug interactions. Concomitant use of active fed compounds linked with other sympathomimetic agents, such as decongestants, tricyclic antidepressants, appetite suppressants and amphetamine-like psychostimulants, or with monoamine oxidase inhibitors which interfere with the catabolism of sympathomimetic amines, may occasionally cause a rise in blood pressure. See contraindications and precautions and warnings. Because of its pseudoephedrine content, active fed compounds linked may partially reverse the hypotensive action of drugs which interfere with sympathetic activity, including bretylium, bethanidine, guanethidine, dobricycwine, methyl-dopa and beta-adrenergic blocking agents. See precautions and warnings. Patients receiving other narcotic analgesics, antipsychotics, tricyclic antidepressants, anxiolytics, hypnotics or other CNS depressants including alcohol, concomitantly with active fed compounds linked may exhibit increased sedation and an enhanced effect on respiratory depression. Codeine, like other opioids, may delay the absorption of the antiarrhythmic agent mixolydian. A larger oral loading dose of the antiarrhythmic may be required. Codeine, like other opioids, may antagonize the effects of metoclopramide on gastrointestinal motility. Alcohol and narcotics produce additive depressant effects on the central nervous system and are a potentially lethal combination. Adverse reactions. Central nervous system CNS depression or excitation may occur, with drowsiness, lightheadedness and dizziness being reported most frequently. Sleep disturbance and, rarely, hallucinations have been reported. Skin rashes, with or without irritation, tachycardia, dryness of mouth, nose and throat, constipation, nausea and vomiting have occasionally been reported. Urinary retention has been reported occasionally in men receiving pseudoephedrine. Prostatic enlargement could have been an important predisposing factor. Overdosage. Symptoms and signs. The effects of acute toxicity from active fed compounds linked may vary from depression to stimulation of vital functions. Therefore, the picture may include lethargy, dizziness, ataxia, weakness, hypotonicity, drowsiness, extreme somnolence progressing to stupor or a coma, bradycardia and hypotension, respiratory depression, meiosis, cold, clammy or dry skin and mucous membranes, tachycardia, hypertension, hyperpyrexia, hyperactivity, irritability, convulsions, difficulty with micturition and nausea and vomiting. In severe overdosage, apnea, circulatory collapse, cardiac arrest and death may occur. Treatment. Necessary measures should be taken to maintain and support respiration and control convulsions. The narcotic antagonists, e.g. naloxone, are specific antidotes to codeine-induced respiratory depression. Gastric lavage should be performed up to 3 hours after ingestion if indicated. Catheterization of the bladder may be necessary. If desired, the elimination of pseudoephedrine can be accelerated by acid diuresis or by dialysis. Clinical pharmacology. Mode of action. Triprolidine provides symptomatic relief in conditions believed to depend wholly or partly upon the triggered release of histamine. It is a potent competitive histamine H1 receptor antagonist of the pyrrolidine class with mild central nervous system depressant properties which may cause drowsiness. Pseudoephedrine has direct and indirect sympathomimetic activity and is an effective upper respiratory decongestant. Pseudoephedrine is substantially less potent than ephedrine in producing both tachycardia and elevation of systolic blood pressure, and considerably less potent in causing stimulation of the central nervous system. Codeine has an antitussive action. It controls cough spasms by depressing the medullary cough center. Pharmacokinetics. After the administration of 10 milliliters of active fed compounds linked to healthy adult volunteers, the peak plasma concentration, max, of triprolidine is approximately 5.0 ml, occurring about 1.8 hours, Tmax, after drug administration. The plasma half-life of triprolidine is approximately 4.0 hours. The max for pseudoephedrine is approximately 190 ml with Tmax approximately 2.6 hours after drug administration. The plasma half-life is approximately 5.5 hours. Urine pH maintained between 5.0–7.0. The plasma half-life of pseudoephedrine is markedly decreased by acidification of urine and increased by alkalinization. The max for codeine is approximately 45 ml with Tmax approximately 1.2 hours after drug administration. The plasma half-life is approximately 2.7 hours. Pharmacodynamics after oral administration of a single dose of 2.5 mg triprolidine to adults. The onset of action, as determined by the ability to antagonize histamine-induced wheals and flares in the skin, is within 1 to 2 hours. Peak effects occur at about 3 hours, and although activity declines thereafter, significant inhibition of histamine-induced wheals and flares still occurs 8 hours after a dose. Pseudoephedrine produces its decongestant effect within 30 minutes, persisting for at least 4 hours. Codeine is readily absorbed from the gastrointestinal tract, reaching peak antitussive effectiveness in about 2 hours and persisting for 4 to 6 hours. Storage recommendations. See packaging. Protect from light, keep out of reach of children. Further information. Pseudoephedrine is partly metabolized in the liver by andemethylation to norpseudoephedrine, an active metabolite. Pseudoephedrine and its metabolite are excreted in the urine. 55% to 75% of a dose is excreted unchanged. The rate of urinary excretion of pseudoephedrine is accelerated when the urine is acidified. Conversely, as the urine pH increases, the rate of urinary excretion is slowed. Animal hepatic microsomal studies have revealed the presence of several triprolidine metabolites with an oxidized product of the toluene methyl group predominating. In man, it has been reported that only about 1% of an administered dose is eliminated as unchanged triprolidine over a 24-hour period. Codeine is metabolized in the liver to morphine and norcodeine, each representing about 10% of the administered codeine dose. About 90% of the dose is excreted within 24 hours, primarily through the kidneys. Urinary excretion products are free and glucuronide conjugated codeine about 70%, free and conjugated norcodeine, about 10%, free and conjugated morphine, about 10%, normorphine, less than 4%, and hydrocodone less than 1%. The remainder of the dose appears in the feces. List of excipients: syrup, glycerol, sodium benzoate, methylpyrrolhydroxybenzoate, carmoisine 122, levamental, ethanol, 96%, mixed fruit flavor and purified water. Trademarks are owned by or licensed to the GSK Group of Companies 2017 GSK Group of Companies or its licensor. Version number, HK022017, GDS01, 20160204. Click subscribe to Users Productions YouTube channel.